Hello everyone, my name is Rax and welcome to my channel, The Rare Normie. Now before we start, please do not harass anyone that is featured in this video. I do not condone violent threats, false accusations, and inappropriate comments. However, opinions, constructive criticism, and suggestions are welcome. Please do not go to the social media accounts of the people featured and don't leave hateful messages. All the pictures, videos, and other media featured here are taken from public profiles, domain, and comments. Lastly, the information here is unofficial and should not be used for anything legal. All persons in the video are innocent until proven guilty by a court of law. Hey guys, welcome back to my channel, and this is Rax. And before I begin, now I may be talking about medical conditions in my video right now, so please, if you have any other medical conditions, please consult with a family doctor, your family doctor, or any other doctors. If you are experiencing an emergency, then please go to the nearest emergency room. Now, my discussions here will be purely for discussion only. It is not to diagnose anyone or to accuse anyone of anything. Now, thank you very much for watching, and on to the video. So there is a little bit of a controversy in the Olympics again. I was gonna make a video about the opening, but it has been covered extensively, and I don't think adding more to the issue would be beneficial for the public. But in this regard, I am going to talk about this person over here. It's because it is actually in line with my profession as a nurse. And I have been a nurse for 15 years ish now. I mean, it's going to reveal my age, but I've been a registered nurse since 2007 in the Philippines, and I am currently a practical nurse here in Canada. Well, like going to get my practical nurse if I finish my SPAP in this month, next month, somewhere along those lines, and I will be taking my NCLEX for my RN registered nurse license possibly in September third week, depending on the schedule that I will be getting. Now back to this person. This person's name is Imane Khelif, and she is a boxer, I think, currently competing in the Paris 2024 Olympics. Now, I mean, basing on the picture, the controversy is deals a lot more on how she looks like, the the allegations that she is a biological male, which I find a bit unfair with several media outlets reporting on how she is allegedly a transgender woman. Now, I've read the articles. I don't have to reference them right now. I'm just gonna give the shorter version. So basically, there were several articles that came out that Iman failed a gender identity test, I think, last year, and I don't think that is the case. Now, why I say that? Because as a nurse, I could see several things wrong with the reporting, and I could see from Iman herself that there are several things that you have to notice before you make a judgment on her condition. Now, Iman, I do believe, is an actual biological female, depending on, like, I don't know her actual medical history, but there are several conditions that would give Iman some physical advantage on regular women. But I'm going to point out several key differences on why Iman is not male and she is actually female. The first thing that you would notice in this picture, yes, you do notice that she has like a different musculature compared to women. She has like you would see for a regular male would have this kind of muscles, as you can see here. And her facial features, she has almost like a square jaw over here, and the nose, and maybe the hairline would be a little bit similar to a male, on how there's like a male pattern baldness over there. Like typical females, they would have like straight over here, but of course some females, depending on their genetics, would have a rounded head. Now the one thing that you notice over here is that Imane doesn't have an Adam's apple. I also got several pictures to double check that one. She doesn't have an Adam's apple. Over here, she doesn't have an Adam's apple. She doesn't have an Adam's apple. Hey, Rax here. So I just did this post edit and just realized that there may be some people who will be questioning with regards why I focused on the Adam's apple. Now, the Adam's apple is something that develops during puberty, especially for males if they are exposed to testosterone during the puberty process, or for females if they have hormone problems during puberty process. Now, there are transgender people, trans women, who don't have Adam's apples, possibly because they were androgynous, they did not grow up with an Adam's apple, or they had a procedure wherein you could shave the Adam's apple away. Now that's a possibility here. Now the reason why I did not consider it for Iman is because she lives in Algeria, and Algeria has a different view on trans women, transgender people. In regards that they are an Islamic country, they don't really have any, like, I don't think they would have procedures for Iman to have feminization surgery. So that's just it. Now, back on to the video. Uh, we're gonna take a look at individuals with Adam's apple. So if a person has an Adam's apple, there's like, it's really pronounced for males. It's really pronounced. You have here, really pronounced over here. This is like a female with an Adam's apple. I think this is an individual with some kind of disorder. But you have here a male. I'm gonna show you the picture. So I have to move around because, you know, for some reason my screen doesn't translate well to OBS. So you have here an individual with an Adam's apple. That's very clear that this individual has an Adam's apple. Iman, on the other hand, doesn't have it. So what is going on here? Now, Iman may possibly have a condition called hyperandrogenism. So, hyperandrogenism is when several male hormones, including testosterone, androsterone, androgen, androstenedione, is being overly produced in the body of a person, or has been introduced artificially into the body of a person. Now, what are the effects of this one? You have here possibility of a thick hair growth. You have here deep voice. I'm just gonna move this a little bit in the middle. You have here male pattern balding, increased muscle mass, and smaller breast size. Now, these are things that we can see with Iman right now. But what causes hyperandrogenism? Now, hyperandrogenism could occur from several disorders. We have here PCOS. Now, I understand this one. My sister has PCOS. You have here malfunction of the adrenal gland, wherein the adrenal gland, it is a small gland that is on top of our kidneys, and it produces androgens and several other hormones important for the function of the body. Now, if there's a problem with your adrenal glands, like for example, it's not producing enough hormones or overproducing hormones. In this case, this is an overproduction of androgens, which is causing male sex hormone androgen being overproduced or being produced too much in the body. And then you have here diseases of the pituitary gland, which is Cushing's and acromegaly. Acromegaly, it is more of the growth hormone. And then you have here obesity and metabolic syndrome, and then certain medications. This one is already the introduction of artificial steroids into the body, which could happen. There are females competing in, for example, bodybuilding, who use testosterone to increase their muscle mass, and they do look like males. Like we have here female bodybuilders, just to see female bodybuilders. So these are female bodybuilders. As you can see, they have larger muscles, but these are individuals that, why can't I enlarge the pictures? Now, these are individuals. Oopsie doopsie. Now, these are individuals who inject steroids into their body, and they would have these ripped, like male looking muscles over here. But as you can notice, they don't have Adam's apples. Trying to look at better pictures for this one. This one, no Adam's apple. This one also, like you can see over here, she is very muscular. She doesn't have an Adam's apple. So these are individuals that introduced testosterone late into their bodies when they were already adults. Now, when does the Adam's apple or the larynx enlarge? It has to be during puberty. Now, during puberty, if you are producing testosterone, androgens as a biological male, you will start to have to show your Adam's apple. If you happen to be female and abnormally exposed to um, androgens, male sex hormones, you will have an Adam's apple. It could happen. Okay, the body is very weird. I will show you why in a few minutes, and it's gonna kind of like might shake the convictions of several right-wing um, individuals. Now, the body can be so different, and although majority are like we are trying we when we label things, we try to go on for like the majority here. Individuals with having this problem doesn't mean it's like they're excluded from the whole group. It's just that they have a problem right now. And Imane, I do believe, has either two things. She has a androgenism through the natural occurrence in her body or a disorder, or I'm not accusing her, the possibility that she has used anabolic steroids during training. It's also a possibility why she failed the test. I think it was last year. Why she failed the test last year. I don't know why it's being reported as a gender test. It may have been just a regular doping test just to check if she used steroids or not. The possibility that she got caught last year and was disqualified, but to try and avoid a scandal or something. These are just alleged, okay? This is not exactly what happened. I'm just thinking that she may have been caught last year using steroids, and to avoid having her record tarnished in the future, they made it out as if it's a failure in gender instead of actual steroid use. There is another individual, a famous individual that had an abnormally high testosterone use, and we are going to take a look at her and why there was much controversy when she appeared and she won several competitions. Now we are talking about Caster Semenya. I'm just gonna have another here. Caster Semenya. So Caster Semenya is a track and field, I think, middle distance runner and Olympic winner. Now, as you can see, I hate moving this one, but I have no other choice. So you have here, she's an individual, and as you can see, she has no Adam's apple. It's not typical for a man to have that kind of muscles to have no Adam's apple. Not typical. I don't actually don't have an Adam's apple. I don't have an Adam's apple. I know it's weird. And let's look at some images here just to see. Now these are images. I'm just trying to find something. Yeah, this one. I hate this. Why do you move so much? There we go. I think I'm gonna lock this one. Yep, so that it won't move anymore. Let's Click here. That's the picture that I showed you. Okay, this one is a good picture wherein you don't see an Adam's apple on her. What's more, you have here no Adam's apple, but that may have been airbrush or something. This just looks like the position of her neck. Doesn't have an Adam's apple over there. Where else? Where else? Where else? Okay, this one is a good example. She doesn't have an Adam's apple, but I do believe that she has a condition that may possibly have produced a lot of testosterone in her body. And again, remember in hyperandrogenism, there is several conditions here. You have your deep voice. We're gonna try and listen to her voice. Let's take a look at her
think the
Adam's
most
apple over
important thing
here.
is that
See,
we
she
need to
doesn't
start
have a
growing
pronounced Adam's
women's
apple
sports. We
compared
need to
to
start
females.
understanding the worth of women in sports
There you go.
and
See, so yeah, no Adam's apple over here. So what is the issue right now? So the issue is some people think Iman is male. I really don't think she is. I think she is female. We're gonna check several more pictures. I think I saw a good picture that shows that she has no Adam's apple. This is one of them. Now, what are other conditions that she could possibly have? Now, this is something that's gonna blow your mind. But there's actually something you call Swyer syndrome. In Swyer syndrome, typical females have the chromosome of XX. So, with the chromosome XX, that's what females have. It tells the body to start producing, especially during fetal development, to start shifting the genitals, the gonads into a specific pathway. But females with Swyer syndrome actually have XY chromosomes. And how does that happen? Now, I don't know. Honestly, even our professor during this time discussing Swyer syndrome. So people with Swyer syndrome have female genitalia, internal reproductive structures. What makes them different from pseudo-hermaphrodites is that pseudo-hermaphrodites would have two genitals, but only one is functioning, I think. Um, true hermaphrodites have both functioning reproductive system. Next, we have here. Now, this individual would have a uterus, fallopian tubes, but the gonads, which could either be ovaries or testes, do not function or do not produce any hormone. And so you have here, they are called streak gonads because they're too small to be functional. And yep, dysgenesis and abnormal development. If you were diagnosed as a female with Swyer syndrome and you were diagnosed, because here's the thing with Swyer syndrome, they don't produce sex hormones. That's why when during puberty they look like individuals with puberty blockers, taking puberty blockers. They haven't developed any secondary sex characteristics, and in order to solve this problem, they have to have hormone replacement therapy. And if this is something that Imane had, she would have been using estrogen to solve her problem. And and how the body reacts to estrogen is kind of funny. It could cause the excess estrogen could cause a reaction for the body to try and balance and produce androgen. But in Swyer syndrome, this individual would have no functioning gonads or testes. And you might think like, is this thing real? Do men have the same thing? Well, yes, actually. Men have something called Klinefelter syndrome, wherein there's an extra X chromosome for the individual. So I think they would have XXY chromosome or just XX. I forgot about that one, but yeah, they do have an extra X chromosome, and The symptoms are typical. You have um, it's not really evident during babies and boys and teenagers. So maybe during teenage time, you would have micropenis for the individual. You have enlarged breast tissue. And here's the thing with the weak bones. Now, for like in Swyer syndrome, why would an individual need to have estrogen? Female would have to estrogen. They could just grow without them. The thing with why it's male and females are different. Estrogen on females helps with the bone growth, how the bones become stronger as they grow older. Without estrogen, females would have less bone density and develop something called osteoporosis. Now, in in males, they need testosterone to have stronger bones. And the reason why kids, females, girls on puberty blockers and then just getting testosterone would have weaker bones. One of the problems of having weaker bones is because the testosterone works differently on their body. It will not help the bone growth, the testosterone on their body. So, problems here when adults, smaller testicles, penis, lower sex drive, but they are very tall, but they have weak bones. That's the funny thing, actually. Maybe the lower density, instead of compacting the bones, they just grow taller, but it would be weak. Less muscular compared with other men. Now, again, just to remind you guys, if you have any symptoms at all, please seek help from a doctor before you try any hormone therapy or medication. Please do that. How is the XX Klinefelter syndrome diagnosed? It's actually very difficult to diagnose, especially in countries wherein they are just okay for an individual, for a boy to be having these symptoms without any problems. Like people with Klinefelter syndrome, they actually just become, they actually lead normal lives without being diagnosed. Like so. Anyway, what happens? Here's the thing with how the body works. Just gonna put her fake picture over there. Um, you don't have to say that this is not an official like medical lecture here. You can still go research on yourself. Now, how the body works is that we actually produce the same hormones during puberty all throughout our adulthood. The levels just vary, and how our body reacts just vary. We produce estrogen for females, androgen for males, testosterone for males. We produce those same things all throughout uh, our lives as a human being. Growth, I will give an example on growth hormones. Growth hormone effects during puberty helps with growing your bones, growing your body, growing your muscles, growing some other types in your body. But once you reach a specific age, the effects of growth hormone, one, it is of lower production. Two, our bodies do not react the same once we reach a certain age. Uh, what happens if your body is still sensitive to growth hormone or it is producing too much? Now we have something called acromegaly. And remember in hyperandrogenism, as I've told you guys, there's an overproduction of hormones, especially male hormones. Now, this is what a woman with acromegaly, they look almost similar to Imane. Imane, best picture so far. This one. You have the jaw that is a little bit squarish. There's a jaw that's a little bit squarish over here. And it's enlarged facial features, enlarged nose. So these are individuals with acromegaly. We're gonna take a look at. Oh, you didn't see that. Okay. This is a like you have here the chin. You have here enlarged nose, similar to Imane. You have here the chin. Actually, you can see the bone growth over here from the lips, the lower lip to the chin is different from this one. We're gonna try and look at other pictures over here. This is the same individual, but yeah, you can see here there is a definite growth on her body. This is an extreme acromegaly. Yeah, it is a condition. what happens with acromegaly, or what causes it? Now, the problem is the pituitary glands that secretes the growth hormone. There you go. That secretes the growth hormone in excess amounts, or your body is just sensitive to the growth hormone, or there is a tumor or growth in your body that produces a similar hormone compared to a similar hormone to growth hormone. I'm so sorry. Sometimes I get these problems speaking. I don't know if it's a tick or something, but no, I don't know. So do males have acromegaly also? Yep, males actually do. It's actually more severe in males, and this is an example. And you might know several persons here. It is actually famous wrestlers. Um, it could vary. There is an individual that would just be like this, looks normal. You've seen people like this, but they do have acromegaly. What else? So this is an example of an individual with acromegaly. You have here facial disfigurement, teeth enlargement, goiter nodules, prognathism. That's when the jaw kind of like protrudes, enlarged feet. So these are hormone problems. Now, what would Iman have? The possibility that she has hyperandrogenism due to a disorder could be possible. She could have the same problem as Castor Semenya, who just produces a high amount of testosterone naturally. She could have used, allegedly, anabolic steroids and got caught last year, which is why the headlines has been showing that she had high testosterone. And yeah, this has reached like 30 minutes, almost 30 minutes now, and I think these are all just all speculations. I do not have Iman's medical history. I do think, though, that this should have been something that the IOC should have investigated properly and given out a proper press release instead of just leaving it to mm, mainstream media and smaller media outfits to report on this one, because I have seen the titles and they're not good. They actually said there that Iman failed a gender test, identity test. I don't think that's real. And I know that right wing individuals have been posting regularly about this, and I don't think it's fair with what they're doing right now. Like, I'm actually a liberal, but more of center left. I have separate issues with the transgender movement, even though I am actually gay. But that's just it. There's too much division in the world right now. I understand a little bit why the right wing are reacting, especially since what happened with the opening of the Paris Olympics opening. Even I think that was a little bit overwhelming, a little bit gross at times, and it didn't help. The opening didn't help. The interviews of the organizers didn't help. The interviews of the individuals, the actors and actresses in the opening didn't help. And Paris being very, very liberal doesn't help also. But for Iman, I am 99% sure that she is a biological female. It's just that it is the responsibility of the IOC to give a proper press release on this one. They shouldn't just keep quiet about it. They need to have a proper press release. Uh, they don't have to like go after right wing media and individuals to tell them to shut up. Just give a proper press release. Just give the proper information on what's going on with Iman. Like, I do think she just has hyperandrogenism. Yeah. See, the squarish jaw. The funny thing is, a lot of Greek Greek statues of females, especially the ones that look a little bit muscular, have I like when I went to a museum, they look like they had acromegaly, which is the funny thing. ADHD brain. Anyway, that's about it, guys. Just to remind again, these are just speculations. These are not diagnoses. I'm not diagnosing Iman. I'm just speculating on what she has. And if you have any symptoms, especially emergency symptoms, you are experiencing a problem, please go to the nearest emergency or call your doctor. And for now, world peace. Have a good night, everyone.